Hello, everybody. My name is Dr. Neil Patel. I'm from UCHC Pediatric Dentistry, and I'm here to talk about dental caries. So what are dental caries, or as we more commonly know it, tooth decay? So it turns out that there are actually millions of organisms that live on our tongue and our teeth. So these are really beneficial organisms, bacteria, that help keep our immune system alive and running, but there are some bacteria that aren't as good, and these bacteria like to produce acid. And it's the acid that can eat away at the structure of a teeth, it's the outer layer of the tooth called enamel, and make them weak. This is what we call a dental cavity. And what causes these dental cavities are bacteria that like to eat sugar. They eat the sugar and they produce the acid that then weakens the outer layers of our teeth to cause cavities. So I have a little picture here that shows dental caries at different stages. So over to the left here, we have a normal healthy tooth. To the right of that, we have what we call an incipient lesion. This is basically the initial weakening of the enamel, which can then progress into a cavity. But as I'll talk about later, there are certain things that we can do at this stage to help prevent cavities. The next one over, we have a well-formed cavity. Now at this stage, there's no reversing it. The only thing we can do at this point is place a filling. That can be a tooth-colored filling, it could be a silver-colored filling, it could be a variety of different fillings, but something would need to be done at this stage. The very last stage is a much bigger cavity. And when the cavities get very, very large, they can affect the inner layer of the tooth, which is called the nerve of the tooth. This can start to cause some pain and sensitivity to kids, and these are the kind of reasons why we might see emergency appointments or walk-ins at our clinic because of tooth pain like this. So what foods cause cavities? A lot of us know the common foods that we typically know cause cavities. These are things like candy, soda, juice, and cookies. They're all things that we know contain a lot of sugar and subsequently are prime culprits in causing cavities. The thing that we might not know is that there are a lot of other foods like white bread, potato chips, pretzels, or even milk that can cause cavities as well. And the reason is because a lot of these foods have either starch or sugar that we don't realize about, and the exposure to these kind of foods, especially the white breads and potato chips, not only can they break down into sugar within our mouths because they can contain a lot of starch, but they also stick around the teeth a lot more. So that can cause patients to be higher risk at developing cavities. And going off of that point, this is why exposure time to teeth matters. So drinking juice 3 times a day with meals is actually a lot better than sipping on the same amount throughout the day, because sipping on that juice every couple minutes, every 20 minutes or so, exposes your teeth to a lot more sugar than that same amount at 3 times a day with meals, because at that time now you have a lot of other things like the other food you're eating or saliva that helps wash away some of that acid producing bacteria and those sugary foods. So the reason we care about this so much is because there are a lot of issues that can cause difficulty in school for kids, and this happens in a number of ways. The first way is that kids can develop pain at school. And as we all know, pain makes it difficult to concentrate on what we're doing at the time. And for kids, that means that they're not really focusing in class anymore. And in some instances, if the pain is really, really bad, kids might not even want to eat at lunchtime or during snack time, and that can lead to malnourishment as well. The other thing is that kids can miss school as well because emergency visits to the dentist caused by pain, like I was mentioning before, or if they go to the dentist and we know that we need to do multiple fillings over multiple appointments, well, now they're being taken out of school to get those fillings done, and now they don't have as much time to concentrate on the schoolwork that they're missing. And the other big thing is a lack of social engagement. These are the times where kids might be at recess or going to after-school activities such as sports, dance class, music, all these things that the amount of time that's focused on dentistry is now being taken away from these things. And specifically at recess, if kids are worried about dental pain or how their teeth look, that may be a thing stopping them from socializing as much as they could. And we know that socialization at this age is really important for children's development. So how can we help our students? The biggest thing we can do is an early establishment of a dental home. So a dental home being a dentist that both the kids and the parents can reliably go to for regular checkups and if they need any treatment. We generally recommend that a dental home is established no later than age 12 months. At this age, kids start to developing some teeth, and this is the perfect age for we as dentists to talk to the parents about their dental habits in terms of diet and brushing to make sure that they're doing the right things. And it also gives chance for kids to get exposed to the dentist so that they're not so scared in the future. And like I mentioned, it's the best chance for regular visits and prevention of caries in the future. The other thing we can do are school screenings. This could be either me, the dentist, or a hygienist that we have in this clinic to go to these schools and help screen some of these kids. A lot of these kids that maybe don't have a dental home and maybe have some untreated cavities. So we're promoting two things. One is primary prevention. So these are the things to help prevent caries from happening in the first place. So that includes teeth cleanings we can do, sealants, which are protective paints on some permanent teeth to help prevent cavities, and then applying fluoride vitamins as well. The other thing we can do is secondary prevention. So these are the situations, like I mentioned before, where we have the beginning of the weakening enamel, but there is something we can do about it. So these are the two things that we mainly can do about it. It's either applying a medication called silver diamine fluoride or prescribing a toothpaste called Prevident. So these are high concentrations of fluoride, which can help target specific teeth to help prevent cavities in areas where we know cavities are starting to develop. So when should we refer to a dentist? This has a lot to do with pain, and the pain can be caused by a lot of different things, but the things we kind of look for are hot and cold sensitive teeth, or pain that's coming out of nowhere or happening at nighttime. These are kind of indications that you might want to pull a kid out of school and send them to the dentist to have that tooth be looked at. And the other thing that you would want to refer to the dentist to are kids that have a lot of untreated caries. So these are kids that have maybe yellow, discolored teeth, and kids that are clearly not getting the treatment from their parents, whether it's they're not bringing them to the dentist or they don't have the right resources, they don't have the right information. So these are the kind of situations where we would want to refer to a dentist as well. So I hope this presentation was very educational for everybody. It's really important that we take the best care of our kids as possible and help them do the best they can in school. And as we all know, regular visits to the dentist for fillings, crowns, all this stuff can be very burdensome for both the kid and the parent. So the best thing we can do to prevent those issues from happening are every 6 months getting checkups for pictures, for cleanings, to check for cavities, and also proper home care as well. So I hope everybody enjoyed today's presentation and have a great day.